Hello everybody. Oh, that's good. Hello everybody. Okay, let's fix this here. Okay, sorry. So, hello everybody. I'm Dr. Ooh, we have a problem here. 1 second. My apologies. Okay. Here we go. 1 second. We have a problem here. Trying to log in here. Okay. So, hi everybody. Now, my apologies. This is Dr. Valeria Soltanik, and I'm very happy today to have my dad here, Dr. Enrique Soltanik, specialist in sexual male impotence. But I'm going to take advantage and discuss a very, very important topic since I have my dad here. He's always busy, and finally today I got him here. So, very important, and you probably have seen it in the news. You probably have someone that you know, or that person that knows someone that has or had oral cancer. And the incidents now, I want to ask my dad to be a little deeper into the topic because I see it too often in the dental clinic. And I think it's a cause for concern because it's a very aggressive form of cancer. Sometimes when you diagnose it, for example, when we see it visually with our eyes, it is already too aggressive. And sometimes it's too late, or the treatment, it's very, very aggressive too. And we need to be able to be aware and be proactive about it. So I want my dad here, Dr. Enrique Soltanik. He has his own channel, but he needs to collaborate with me today.
Yeah.
So to discuss a little more this topic. So how do we get that oral cancer?
Okay, there are three important causes of oral cancer. One is excessive smoking. The other is an excess in alcoholic patients. And the third one is one of the things we are seeing more and more is for oral sex. And also there is a study done in the United States also, in which the more people that has oral cancer with one person, it says above 4 partners, different partners, you have oral sex, you can deliver for the HPV virus, oral and pharyngeal cancer. And that is what we see in the last 10 years, more aggressive and more cases. Why? Because now many young people, they don't want to use the condoms and they do it directly, and that is a very, very dangerous one because it's not that we want to be Puritan, but you need to take care of yourself because there are consequences that are very, very severe. And the treatment sometimes is very severe as well. Not only it needs sometimes surgeries, it needs medical treatment, and also it's very important to take for the female the vaccine to prevent the HPV. And that is a very aggressive virus, and it's not the following day you will know that. It's always about a week or 2 weeks that the lesions starts to appear.
And I know for a fact, correct me, because you know you're a doctor and MD. Um, the male is more of a they transmit more, right? And we see it more like the female
the female is the one that transports the virus, and many male do also oral sex in the female, and then they catch the virus and they pass to another female when the female does the oral sex on them.
on another partner too. Okay, so I've seen a case that I had in the clinic of a lesion in the palate of a male that it was tentacle like. So it was later sent to pathology and it was HPV. We removed it. It was very early stage, the lesion. But I always recommend on my videos, and tell me if it's correct too, to whatever lesion happens in the inside your oral cavity and under the tongue, on top of the tongue, on the throat.
Even in the throat.
In the throat, very important. When we brush our teeth or floss, always check in the mirror. It takes a few seconds to check, and you always know how you look, because you should look the same every day inside your mouth. So I think
and the
it's
most
very
important thing is to catch it at the early stage. That is the secret. Not when the lesion is very big, and that is something that it's too late. Always it has a way to solve the problem, but the more aggressive the cancer is, the more aggressive the treatment will be.
Yes, if it is savable.
Yes.
Because I've seen cases that we had discovery and they were not successful after because it was catched at a very late stage, because it's very aggressive. It's not as it can be some type of a breast cancer or other type of cancer in the oral area. It's quick. It's 1 to 3. That's why importance in catching it. You going to your doctor, dentist for regular checkups. You yourself have to do your own checkups as well, because if you see something, you have to go. I prefer if it's nothing, it's better than leaving something for a long time. So my rule is always, when I check a patient, to follow up. When I see something, we document, take pictures, annotate sizes, form, and to see the patient again in 2 weeks. If that disappeared, then it should be okay, but also it has to be checked by a doctor, because sometimes you have something that disappears the top layer, but it stays, so it stays and that continues. So
yes, and also remember that the more partners you have doing the same sexual procedure of oral sex, the more risky you have to get the cancer. That doesn't mean that only with one you can do it and get it, but it's a study that says that more than 4 or 5 partners that do with you oral sex, you can get the cancer, oral cancer, or in the throat. So we try to give you some advice, and we hope you can absorb it and have a healthy life.
yes. So remember, whatever questions you have, any topics, we are here. I'm here to answer the questions. If you have any questions regarding sexual male impotence, it's a little foreign to my career, but still we have some connecting topics that in the future now we will discuss together, because I think it's very important to have the knowledge of an MD. So you can ask the questions here, or you can follow my dad's channel, Dr. Enrique Soltanik, on YouTube. I'm going to write it on the comments below, so whatever questions you have or interest, he will answer. So thank you so much, and thank you for sharing this special moment that finally I was able to have my dad in a video to reach everybody. Everybody's so important to me, and I'm very, very happy to finally have a video with him. So much knowledge, and he's the one that whenever I have a medical question that pertains to my profession and my brother's, he's the #1 person that I ask. So here it is. So thank you so much.
And thank you.
And thank you. And we'll see you soon. And thank you. Whatever questions you have, you can write them below and we will answer. Thank you.
Bye. Thank you.
Bye
Be
bye.
safe.